Good afternoon, everyone. Delighted to have you here. We'll just wait a minute or two to let people sign on. And welcome everyone to our, I think, third or even fourth COVID-19 webinar. This is a special one. It's to commemorate Awareness Day, which is a month of, in fact, May is a month of international awareness for many illnesses. ME, fibromyalgia, Lyme disease, Ehlers-Danlos syndrome, and many others. In 1992, Thomas Hennessy founded May the 12th as the International Awareness Day for Chronic Immunological and Neurological Disease. So we're delighted to have Dr. Sarah Myhill with us today, who I'm sure you all know. She qualified in medicine with honors in 1981 and has since been working tirelessly, first of all 20 years on the NHS and then another 20 years, and is still focused in private medicine on identifying and treating the underlying causes of health problems. I think I'll turn over to you, Sarah, to ask you to just introduce yourself in a few further words. Thank you, Sarah.
Well, I have to say, sometimes I'm ashamed to be described as a doctor because their reputations are so awful. But the bottom line is, I'm a practitioner of ecological medicine, and that is all about asking the question, why? What are the underlying mechanisms that result in that clinical picture? The problem with modern medicine, as you are so aware, is it centers around symptom suppression with medication. Now, you suppress symptoms and you mask the very clues that we need to ascertain mechanisms, why that person is ill. So ecological medicine is all about following that path. And I think my job as a doctor, and of course doctor comes from the Latin, it means to teach. My job is to teach my patients, to give them, as I call it, the rules of the game and the tools of the trade so they can do it themselves. Because there simply aren't the good doctors and the good therapists to go around to teach people to heal themselves. And this is why you guys are listening to this seminar today. My job is to teach you and give you the tools so that you can heal yourselves from chronic fatigue syndrome and ME and face the COVID-19 epidemic with confidence. Okay, Gillian, I can't hear you, I'm afraid. So
I'm sorry, I had muted. While you're speaking, I'll try to mute myself. But at the bottom of the screen, everyone, you'll see a Q&A button, and you'll be able to ask questions throughout the webinar, and we'll be asking Sarah both those questions and some that have already been sent in advance via Facebook forums and so on. So Sarah, I'll just begin with a few general questions, which is, you see a vast range of patients who've been diagnosed with ME and other conditions, but specifically ME. Could you give us an idea of the conditions that you find often underlie this term?
Well, the key point to remember about chronic fatigue syndrome and ME is neither a diagnosis. They are clinical pictures which present, and we then have to ask the questions why. Now, in chronic fatigue syndrome, this is all about poor energy delivery mechanisms. And to explain those, I constantly use the car analogy. For your car to run, you've got to have the right fuel in the tank, which has to do with diet and gut function. You have to have the mitochondrial engine, then you have to have the thyroid accelerator pedal and the adrenal gearbox, and then, of course, good quality sleep for servicing your vehicle. With the ME patients, yes, they have a chronic fatigue syndrome, but they also have symptoms of inflammation. And inflammation occurs when the immune system has been activated. And that may be for reasons of chronic infection, of chronic allergy, and autoimmunity. I would hate to say there's one common cause for ME, because it just isn't like that. We have to tackle the whole thing as a package. But my guess is actually probably allergy is as common as chronic infection, and very often the two things coexist. And it's by looking at that patient's history and symptoms that you can tease out the different threads that give us the best approach.
Thank you. Well, one of the most common questions patients have been asking is, am I at risk? In other words, if patients have what you've now just defined as ME, would you say that they're at risk, or are there many different gradations in that answer?
My guess is that the ME patients are probably at greater risk of picking up COVID-19 than, let's call it, the normal populations, simply because so many cases of ME are infection driven. The commonest things are chronic Epstein-Barr virus, chronic Lyme disease, mycoplasma, and chronic fungal infections. They're the four top ones that come up time and time again. And the reason those microbes have got in to cause disease and drive inflammation is because that patient's immune system is not functioning as well as it should. So if that is the case, and my guess is it is, then they will be more susceptible to COVID-19 for the very same reasons that those other chronic infections have got into their systems and are driving their disease and their ME.
Okay, thank you. Well, that was another question that Lyme patients in particular have asked, is whether they're particularly susceptible, but you've helped to answer that already. There are also some RNA viruses that patients who I know you often see are diagnosed with, like Coxsackie or echovirus. Do you think that there are likely to be any connections between those viruses and susceptibility to this new RNA virus, COVID-19?
I think it's biologically plausible. At this stage, again, we simply don't know, but it is biologically plausible that that is the case. And those microbes, as I say, are present in that body in detectable amounts because the immune defenses are not working well. And the big issue that has been ducked endlessly by politicians, by doctors and so on, is the immune system. That is the elephant in the room. Nobody's asking the question, why does patient A get COVID-19 and succumb and die, and patient B doesn't? And the answer is the immune system. You know, if you don't get COVID-19, or you get a very mild infection, or you get it and you recover well, it means you've got a jolly good immune system. So what the question we should really be asking is, what can we put in place now to improve our immune systems? And which tools of the trade can we employ at the first hint of any infection with COVID-19, or indeed any other microbial invader? So that's the big question.
Okay.
Would you like me to answer that one now?
Yes, of course. Do, please.
Now, I run a mentoring group of doctors who are working within the NHS and are currently on the front line. And I had a fascinating email from one of those doctors who said that of the 30 odd patients who he had seen and treated with COVID-19, they all had BMI above 30. They were all overweight. And those patients that died, and I think he said 8 died, all had a BMI of over 34. So what this means is that obesity is a major risk factor for the serious sequelae consequences of COVID-19. And this leads on to my first important point about preventing this disease. Sugars and carbohydrates make us susceptible to infections, not just to viral infections, but to bacterial infections and fungal infections as well. And if we are eating a diet which is high in sugars and carbohydrates, we will run high insulin levels, we will develop metabolic syndrome, we will become overweight and then diabetic. And it's those overweight people, those people who are diabetic, they are the ones that are susceptible in particular to COVID-19. So the first and single most important thing you should be doing now is start yourself on a paleo ketogenic diet. Cut out the sugars, cut out the carbs, cut out the high sugar fruits, because all those suppress the immune system because you end up running a high blood sugar and essentially are a very comfortable breeding ground for these infections. So the paleo ketogenic diet is the starting point, and that you can do now and put in place now. The second reason why people succumb to COVID-19 is because they get a large loading dose of virus. And so we have to put in place these interventions to keep that loading dose down. So there we have on the front line very fit and healthy doctors and nurses who should be who should cope with this virus fine, but they get a big loading dose because they are dealing with patients who are excreting vast amounts of virus. In particular, Black and Asian doctors seem very susceptible to COVID-19, and we now know this is all about vitamin D, because if you have a dark skin, you are not so good at making vitamin D from sunshine. So vitamin D deficiency is a major risk factor for COVID-19 and all other respiratory influenza diseases. This is, again, in the literature and well proven. So how do you stop yourself from getting a big loading dose of COVID? And the answer is, where do you get it from? Well, you get it from contact and you get it through inhalation. And the two tools which I recommend that my patients use are, first of all, to use, and they're both based on iodine. Now, iodine has a long history of efficacy against all microbes. In fact, there is no resistance of any microbe, whether it's a bacteria or a virus or a fungus, again, for iodine. Contact kills all those microbes. So everybody can very cheaply and very inexpensively make up iodine oil, which is 10 parts coconut oil to 1 part Lugol's iodine. And they're cheap. Everybody can avail themselves of those. And with any foreign contact, picking up the post, going shopping, driving your car, whatever, apply about a grape-sized amount to your hands and rub it in. Hands, forearms, and around your face. And that will instantly kill any virus that happens to be stuck onto your hands or your face. And then the other very helpful intervention is to sniff iodine. And for that, I recommend my patients use a salt pipe, which looks like that. If you haven't got a salt pipe, you can make something very easily from a vitamin container, something like that. Plug some holes, put some holes in the bottom, little wad of cotton wool, fill it up with sea salt, and then a couple of drops of iodine in there, and you just sniff it. And the point is, iodine is volatile. If you sniff that 2 or 3 times a day, you will contact kill all viruses in the upper airways and the lower airways, and that keeps the loading dose down. Now, if you keep the loading dose down sufficiently, the immune system has the time to gear up to producing an adequate antibody response, and that is hugely assisted by vitamin D and hugely assisted by vitamin C. So in addition to the Paleo ketogenic diet, we should all be taking at least 10,000 international units of vitamin D daily and 5 grams of vitamin C, little and often. Put it in a glass of water, slurp it through the day, and do all those things, and you will greatly increase your chances of surviving COVID-19. In fact, so far, touch wood, not all my patients have survived COVID-19 without any problem at all. And if you want details of how to do this, or references that underpin these interventions, then one of my patients has created a website called NHS Corona Doctors on the Front Line. And Gillian, I'm sure, can provide you with a link. But there are lots of good references in there, details of the clinical path of this illness, and an extensive question and answer session that you can pick up.
That's extremely helpful. Thank you so much. We'll put that up in the question and answer section now, if we can, and we'll also make sure that we exhibit it when we post your video as well. We'll maybe put it on the bottom of the screen. Thank you. There was a question related to vitamin C, which was when somebody finds that it's burning with the 5 grams, how can they still titrate upwards without a problem?
Okay, I mean, the cheapest and best form of vitamin C is ascorbic acid. Now, if you are doing a paleo ketogenic diet, then you should tolerate ascorbic acid absolutely fine. But if you are not on a paleo ketogenic diet, if you're still running on carbs, then there's a tendency to upper fermenting gut. And that often manifests with indigestion, reflux, and intolerance of vitamin C. Now, in the short term, the cheapest and easiest way to deal with that is to simply neutralize it with sodium bicarbonate. And if you take 2 parts of ascorbic acid to 1 part of sodium bicarbonate, it's cheap, cheerful, in your kitchen cupboard for sure. you can then produce a neutral solution of vitamin C, which is doesn't irritate the stomach and perfectly well tolerated. So
thank
you. Easy information there.
Thank you. Somebody else asked how long you should separate vitamin C and iodine, because you said they shouldn't be taken at the same time.
Okay, we're using them in different ways. Now, vitamin C, I call it, kills from the inside out. So you swallow that little and often throughout the day. Iodine, we're getting onto our bodies by applying it to the skin and by sniffing and inhaling it. So iodine kills from the outside in. And this is, if you look at, I've written a book called The Infection Game, Life is an Arms Race, and I make many analogies with, fighting foreigners on a macro scale. And, a classic general's move would be to have a pincer movement where you attack them from the right wing and you attack them from the left wing and you squash the middle. It's exactly the same with vitamin C and iodine. Vitamin C kills from the inside out, and iodine kills from the outside in. So there are, it's a heaven-sent combination. And because they work in different ways, then the virus simply doesn't have a chance with, say, that pincer movement going on.
Yeah, but you've said that you should take them apart in time. You shouldn't take them at the same time. So somebody asked how many hours apart?
That is the case if you're taking them both by mouth, orally, swallowing it. But what I'm saying is that with the inhaled iodine, there's no problem at all. You can take them when you like and when it's convenient.
Get that completely. Okay, thank you. Another question was, do you get the impression that there are different strains of COVID-19 in the UK, or do people just react differently depending on their state of immunity, as you described earlier?
I don't see enough patients to know that. And we don't have the science back to ascertain how many strains of COVID-19 we have in this country. But the bottom line is it's irrelevant to clinical practice, because the treatment of COVID-19 and indeed any respiratory infection, whether it's influenza or bacterial infection or whatever, is exactly the same. You improve the immune defenses with a paleo ketogenic diet, with vitamin D and with vitamin C. And when that microbe comes along, and it doesn't matter what the microbe is, you hit it in exactly the same way. I detail this in the book, The Infection Game. And the strategies that I use to treat, I call groundhog strategies. And the reason I call them groundhog strategies is because, like the film Groundhog Day, I keep coming back to them over and over and over again. Now, all these strategies are free and available to you all on my website, drmyhill.co.uk. But what I'm saying is, at this stage of the game now, put in place Groundhog Acute. So get your body in a fit state to meet the challenge of. At the first sign or hint of any infection, whatever that may be, you apply Groundhog Chronic. And that's where we put in things like vitamin C to bowel tolerance, inhaled iodine, but more frequently, maybe herbal preparations, use heat, do not symptom suppress with drugs, all those sort of things. And that allows the body to deal effectively with acute infection. Okay. And then, of course, I see patients who have chronic infections, which is part of ME. And for those patients, they have to apply Groundhog Chronic. Those are things we should all be doing all the time to deal with chronic infections.
Okay, thank you very much. So that was another question we'd received in advance, which was, do you think there's a genetic link to how severely it affects a person, or why are some people with no apparent underlying health issues being affected so badly? Would you say that everything you've just said about immunity applies there as well?
Well, absolutely. And of course, the governments tell us that, and healthy people are getting COVID-19. But by my definition and by your definition, they're not healthy people. Why? Because they are not doing a paleo ketogenic diet. They are not taking decent doses of vitamin C or vitamin D because they're sun deprived or whatever. So what one person defines as a healthy person may not be the same. And my view is that you can only begin to be a healthy person if you're at least doing Groundhog basic, a paleo ketogenic diet and some good nutritional supplements to deal with the fermenting gut and so on and so forth. So that's all about definitions.
Thank you. Another is being on ACE inhibitors to control blood pressure a particular problem in COVID-19?
Yes, and that's been well proven because the way that this virus accesses the body is via those ACE inhibitors. So, drugs which interfere with that are very likely to increase our susceptibility to COVID-19. I mean, in this country, as you know, there's been a particularly high incidence of mortality amongst care homes. And my guess is that part of the reason for that is that, care homes, they are feeding all their customers, all their clients, high carbohydrate diets. They're all on a shopping list of drugs, which probably includes statins, ACE inhibitors, and so on. And they're certainly not getting any good vitamins or minerals. So, and that, and also there's a concentration of people there, they're getting a big loading dose of virus. So everything is stacked against them. So no wonder there's a high mortality in care homes.
Okay. Yeah, understand. I'll just ask one more from the questions we got in advance before switching to those that have come in, which is, I have macrocytosis, so struggle to get oxygen when trying to walk, etc. Will this affect me, and will I be more susceptible to COVID-19?
Okay, well, macrocytosis simply means your red cells are too big. And we have asked the question, why are they too big? Now, that may well be a symptom of poor methylation, i.e. vitamin B12 deficiency or folic acid deficiency, and that person needs to measure their homocysteine, which is a very good measure of methylation. So that's one possibility. The second possibility is macrocytosis is a feature of hypothyroidism, and I would want to investigate that person's thyroid, because that will impact directly on energy delivery mechanisms. And guess what? The immune system, when activated, is enormously demanding of energy. And if you cannot deliver energy to that immune system, then it will not be able to deal adequately with an infection that's coming in. And many of my ME patients, they start off their clinical history with a sort of fatigue, which may be diet related, it may be mitochondria related, it may be a thyroid or an adrenal issue. And then they have an infectious challenge, typically Epstein-Barr virus, which seems to come up very commonly, and they do not have the energy to mount an adequate immune response. And therefore that virus becomes chronic and drives autoimmunity and chronic inflammation. And the ME patients then have the symptoms of inflammation as well as the symptoms of poor energy delivery. And those symptoms of inflammation are, feeling ill, malaise, maybe swollen lymph nodes, a tendency to run fevers, organ inflammations like pericarditis, or even brain symptoms. So, as I say, inflammation, that combination of inflammation and poor energy delivery mechanisms can produce almost any symptom you care to mention. And what we have to do as doctors is try to distill that down and try to pick up the threads and work out what is causing what. But of course, by the time people who come and see me, which is often 5, 10, 15, 20 years of illness, the water has become muddy, as I call it. The clinical links have been obfuscated by symptom suppression, medication, life, whatever. And so teasing those threads is a central part to diagnosing that patient.
Okay, well, everything you've said indicates that taking precautions at the moment is particularly important, because that's one of the questions that's already come in, which is, should I be taking any supplements even though I don't have COVID-19? For example, the salt pipe and iodine. Should I be using this before any infection? I would guess your answer is yes to that, but please, just sort of.
Yes, I think so. I mean, if you're going to the important things to do is, first, do the Paleo ketogenic diet. Sugars and carbohydrates increase our susceptibility to disease for a multiplicity of reasons. So that's the first thing. Second thing is vitamin D is a proven benefit against COVID-19. So we should be taking at least 5 and ideally 10,000 international units daily, which is much higher than that which you get prescribed on the NHS, which maybe only give you 400 international units. The point is, up to 10,000 IU daily, there have been no complications, no side effects. It's a completely safe thing to do.
Well, especially with everybody staying inside at the moment, barely going out into the sun. Yeah.
Thirdly, you need to take vitamin C, at least 5 grams a day. And that will give you good blood levels, good levels throughout the body. And vitamin C is a proven benefit against all viral infections. And it has a decades of history of effectiveness against a whole range of viral infections and bacterial infections, from septicemia to viral pneumonia to meningitis to polio and so on. Vitamin C, a proven value. And then the final thing you do is you keep the loading dose down. And that is all about using iodine oil to keep the loading dose contact down, and using a salt pipe, sniff iodine a couple of times a day to, again, if you have been inadvertently exposed, that will keep the loading dose down. That then gives the immune system time to mount an effective immune response.
Okay, that's super. Thank you. Do you see or imagine that there are any connections between mast cell activation syndrome and COVID-19?
Well, again, it's all about looking at mechanisms, and mast cell activation means that the immune system is busy with respect to allergy. And we have to ask what is driving that allergy. And I suspect mast cell activation has something to do with the fermenting gut. And I would hate to be specific on that point because we don't really know. But what I can say is that when my patients put these regimes in place, when they, the fermenting gut occurs when you're eating a diet which is high in sugars and carbohydrates, and those foods get fermented by bacteria and yeast instead of being properly digested. In that situation, that seems to activate the immune system in the gut. Again, if you look at this from the point of view of the immune system, and 90% of the immune system is gut associated. The immune system in the gut constantly looks at a huge soup of bacteria and yeast in the gut, and indeed many viruses as well. And it has to decide, well, which of those are friendly and we can ignore, and actually which of those are potentially pathogenic, and we need to mount an immune activity to keep them at bay. And one of the symptoms of immune activity in the gut is that person tends to dump fat around their middle, i.e. they're apple-shaped. And so the person who has the beer belly, whose waist dimensions are greater than their chest or the hip dimensions, they are dumping fat around their gut. And the reason they're doing that is because they have a fermenting gut. And the immune system is very busy there, keeping at bay the fungal fermenters and the abnormal bacterial fermenters. And one of the clinical characteristics of my patients who do paleo ketogenic diet and take vitamin C to bowel tolerance is that central obesity disappears. And as that central obesity disappears, so their blood pressure comes down, their blood sugars come down, and their fatty liver melts away. So this, so not only will the paleo ketogenic diet protect you from COVID, it will also protect you from the diseases of Westerners. Dementia, which is now being called type 3 diabetes, heart disease and arterial damage, and of course cancer. So use COVID-19 as a very good excuse to say, let's do it. Let's just get on with it. Let's establish the paleo ketogenic diet, stop us, protect ourselves from COVID-19 now, and most importantly, protect us from other nasty diseases in the long term. And one of the nice messages I can give to my chronic fatigue and my ME patients is, you put all this stuff in place and your best years are ahead of you.
Okay, thank you. One question has come in, which obviously a lot of people always do ask, which is your opinion of hydroxychloroquine for treating COVID-19. I don't know whether that's appropriate to ask.
Well, as I keep saying to all my patients, I'm a great advocate of the KISS principle. Keep it simple, sweetheart. So don't get diverted by fancy drugs and things which are unproven. But the hydroxychloroquine story is a very interesting story because it illustrates a fascinating aspect of COVID-19. Now, one of the reasons why COVID-19 has such multiplicity of effects in the body is it splits iron from hemoglobin. So what that means is you end up with blood which cannot carry oxygen. And one of the interesting features of patients coming into hospital, and I'm learning this from my clinical colleagues, is that they're coming with oxygen saturations of maybe 75%, 70%. And it's not because their lungs are at fault. Their lungs are working fine at this point. It's simply that the blood cannot carry the oxygen because the iron's been split off. Now, this has another very nasty effect, because if iron is floating around in the bloodstream, it's a very dangerous molecule. Bound up in hemoglobin, it's safe and desirable and necessary for carrying oxygen. But as free iron floating around, very dangerous stuff. And it switches on the immune system. And we now know that serious COVID-19 infections are characterized by very high levels of iron in the blood. And that switches on the cytokine storm, which is the bit that really does the damage. And this is another way in which vitamin C is incredibly helpful, because vitamin C will grab that iron molecule, neutralize it, and prevent it causing damage. So that's two ways in which vitamin C is helpful.
Okay.
And where hydroxychloroquine comes in here, or where chloroquine comes in here, is it prevents iron being split off hemoglobin. And interestingly, that is the mechanism by which malaria causes black water fever. It also causes a hemolytic anemia. And so it's not that the chloroquine is killing the virus, it's just that it's protecting it from some of its more malign effects. But what I'm saying is, you put in place all the groundhog interventions, you do the diet, take the vitamin C, take the iodine, and the vitamin D, and you won't get into that problems in the first place. Chloroquine will become irrelevant.
Okay, thank you. From what you've just been saying there, it sounds as though ventilation might not be the most ideal intervention. Is that something you've heard as well? Because there is one, which I'll ask in a moment, which does involve ventilation, but I just wondered if you could clear that point up first.
Well, again, I don't have any first-hand experience of COVID-19 patients who are that sick. I'm not a frontline NHS doctor. But what I have heard from my colleagues is that you put them on the ventilator and you're going to create as many problems as you're going to solve. So oxygen, yes, may be helpful, but artificial ventilation, it's a two-edged sword. And obviously doctors do that because they want to be seen to be doing things, but there is some evidence to suggest that it's actually not a helpful intervention.
Okay, thank you. Because this question here from a therapist related to giving people IV NAC as an antioxidant if they have a null for glutathione S transferase, in other words, GSH polymorphisms. Is that something you can imagine is useful, whether or not they're on a ventilator?
Well, it's biologically plausible, but the fact of the matter is we already have had fantastic studies completed in Wuhan in China and in New York, where intravenous vitamin C has resulted in a cure in every single case. You've got to use enough vitamin C in adequate doses, and once that patient is established on the regime, they have all survived. So, as I say again, keep it simple, sweetheart. There's no point experimenting with esoteric, biologically plausible ideas when we've got an incredibly effective tool that does the job and has been proven to do the job over decades, and has proven itself again in at least 2 centres of excellence. So, let's say, keep it simple.
Okay, well, here's a more patient-specific question, but I'll ask it anyway. I had an upper respiratory tract infection in 2005, which led to a diagnosis of ME. Since then, I've been prone to repeated chest infections. How can I actually tell whether I have COVID-19? I'm not sure I would know, as my temperature has regularly been up to 37.6 and breathing has been difficult for 2 years.
Well, that person has already a chronic infection, either in their airway and their upper airways or their lower airways. And the two likely possibilities that come up time and time again would be either chronic fungal infection, and we know this from the work of Joseph Brewer and his work with mycotoxins, or chronic bacterial infection, and the one that comes up so often is mycoplasma. So I would want to apply interventions to treat both of those things. But again, one of the nice things about the groundhog regimes is it doesn't matter what the microbe is. These regimes are designed to improve the immune defenses, and the tools that we're using, vitamin C and iodine, are effective against all microbes. I mean, I've now got 4 patients with bronchiectasis, which is chronic lung infections. And by dint of doing groundhog interventions, and in particular vitamin C to bowel tolerance and the iodine salt pipe, their requirement for antibiotics has fallen to 0. And I've been following up these patients for some years now. So these interventions are highly effective, and that questioner needs to put my groundhog chronic intervention in place as soon as he can. And as I say, then the waters will become less muddy, they'll become clearer, and they're available on my website, drmyhill.co.uk.
Thank you. This is a bit specific as well, but it may apply to a lot of other people. Are there any long-term impacts of inhaling iodine on the body's natural immunity? Would you recommend continuing iodine inhalation after this acute COVID situation has passed? And does the burning sensation that I presume she feels cause any negative impact on the throat long-term?
Well, if there are burning sensations, then she's using too much iodine. Because yes, in big dose, it can be irritant. The fact of the matter is the amount of to smell the iodine is a therapeutic dose. If you can smell it, you're not doing any harm. If it's causing burning, then yes, it's irritating her airways and she's having a little bit too much. But the safe dose of iodine by mouth is extremely high. And when Lugol developed iodine in the 19th century, he was using tens and sometimes hundreds of milligrams a day. It's gloriously safe stuff. It's not stored in the body and it's very readily excreted in the urine. So the potential for toxicity is virtually 0. So it's one of the tools that I love to use because it's cheap, it's effective, anybody can get it, it's extremely safe, and it's a very useful tool for a multiplicity of clinical pictures.
So it can be used long term then?
Absolutely, yes. And the fact of the matter is, as you know, if you're not taking iodine, then you will be deficient. I have never seen adequate levels of iodine on testing in somebody who's not taking supplements. And let's face it, the safety range between a therapeutic dose of iodine and a toxic dose is huge. I mean, compared to fluoride, it's enormous. I mean, the toxicity range for fluoride is so narrow that we cannot use it safely therapeutically. And the idea of putting fluoride in water and toothpaste is extremely dangerous because that therapeutic range is so narrow. Iodine, very safe stuff.
Okay. Well, various people are asking whether you could repeat your protocol for inhaling iodine with salt. And I think what we'll do is put a link to your video where you explain how to do that under the recording of this. And also they're asking about that NHS Doctors Frontline Support website. We will put that, if that's somebody who joined a bit late, we'll be putting that up on our website afterwards, or we'll put it at the bottom of the video, which, by the way, some people are asking, will you be able to get this afterwards? Yes, we'll be putting it up on the website. And where it is on the website is under COVID-19 webinar series. That's a tab under events on the AONM.org website. So here's a question. It looks a bit complex, but I'll just read it anyway. Hi, Sarah. I work with Professor Montagnier, who has looked at the SARS-CoV-2 sequences in detail. He's identified HIV, SIV, GP 120 sequences, and so on. I've looked into this and can confirm the unusual origin of these sequences. Oh, I'm happy to share more information if you'd like. I don't actually think that's a question. So what we'll do is we'll transfer the details of this particular person to you in case you'd like to follow that up. Because of course, Professor Montagnier, who I'm sure you know, is a wonderful person to communicate with. Another question here, can you take vitamins C and D together? In other words, at exactly the same time?
Yes, no problem at all. Bear in mind, vitamin C is a fat-soluble vitamin, and so you'll get better absorption of vitamin D if you take that with a fatty meal. But yes, of course, you can take the two together, no problem at all.
Great. And you've just mentioned mold and fungi, and we know that you have a conference coming up that you're helping to organize together with the British Society for Ecological Medicine, of which I believe you were, you ran for many, many years. And that'll, I think, be in November. Are there any tests, this person is asking, that can show that your ME is actually caused by mold or fungi?
Well, Emmy, I mean, people love to have a single driver of their disease, and it's never like that. And I would not ask my patients to do any tests for any chronic infection until they have done groundhog chronic regimes, which is all about looking at energy delivery mechanisms and all about improving the immune defenses. The point being that those regimes done really well will cure an awful lot of people. And now when people come back and see me for follow-up appointments, I always say, are you doing the Paleo Ketogenic diet? Are you in ketosis? How much vitamin C? How often are you doing the iodine? Are you doing the heating regimes? Di-da, di-da, di-da. And the reason I do that is because I so often have patients coming to see me who have had mega doses of vitamin C, mega doses of antibiotics, and they've been to America, they've spent a fortune, and they are no better. And the reason for that is with any antimicrobial, you just get a percentage kill. You can never kill every last microbe with that. That is up to the immune system. So I wouldn't advocate any fancy antimicrobials, whether they're antifungal drugs or antiviral drugs or antimicrobial drugs, until groundhog chronic is well established. And then yes, there may well be a role for them, but if people can do it in that order, their chances of success are going to be so much greater, because fighting these microbes, it's not a battle, it's a war. It's a war that we fight for life, and it's a war we're all going to lose. We're all going to lose it because guess what? Those microbes drive they drive cancer, they drive dementia, they drive heart disease, and they are the big killers. Now, if I lose that war when I'm 120, I'll settle that. I'll say, right, that's fine. But I don't want to lose it tomorrow because I'm still having fun. I'm still enjoying myself. And it's exactly the same with the ME patients. You've got to hit that microbe with every which way you possibly can. And you start off with the basic things to improve the immune defense, the things that you can make as part of your everyday life, like the PK diet, lots of herbs and spices in your food, lots of vitamin C, vitamin D, iodine, heating regimes, detox regimes, all those things. And then maybe, yes, you will need the antimicrobials. But it's got to be done in a proper order or you risk failure.
Yes, thank you. So I won't ask the second part of the question, which was if I'm on nystatin, will that increase my chances of getting infected with the coronavirus? Because I can see your answer would be, first of all, try the natural approaches, right?
Well, I mean, nystatin will help to reduce the infectious load. It will give the immune system less work to do, and therefore the immune system will have the energy and the raw materials to deal with other infections. I mean, this is why we talk about co-infection so often, because if you've got one infection in the system already, then the immune system's, say, raw materials and energy are being directed at that one infection, and that allows the other buggers to get in. And so we often end up with people with a multiplicity of infections because they simply cannot cope with the main one. So again, this increases the imperative to use groundhog regime. Maybe the immune system can get ahead of some of the minor ones, and that leaves us with a few big ones that, yes, we have to hit with antibiotics or antivirals or antifungals or whatever. But start off, as I say, with the basic approach of getting yourself in as fit state as you possibly can.
Thank you. You mentioned the problems related to ACE inhibitors earlier. A question has now come in from somebody who's on ACE inhibitors who's saying, well, what can she do to mitigate the risk then? Would you say that they should go to their doctor and say, can you put me on an alternative blood pressure medication?
Well, the first question we have to ask is, what is the cause of the blood pressure? And the number one cause of blood pressure is metabolic syndrome. And so often with my patients, I put them on a paleo ketogenic diet. I recommend that they monitor their blood pressure, and guess what? They can come off the drugs. So, that is a great start. But, that patient taking ACE inhibitors, you've just got to do all the groundhog interventions, with greater assiduousness than anybody else. You must start the vitamin D, do start the vitamin C. We have all these other tools to help us, which will mitigate the effect of the ACE inhibitors. But as I say, that you've got a very good chance of being able to come off your blood pressure drugs if you put these regimes in place.
One question related to what you've been saying too is, does taking a vitamin D supplement reduce your body's ability to produce it from the sun?
Oh, not at all. In fact, this is one of the wonderful illustrations of how effective the body is, because to get 10,000 international units of vitamin D requires about an hour of sunbathing, Mediterranean sunshine, whole body exposure. But as the vitamin D levels come up, the body just stops making it from sunshine. So you can't overdose with vitamin D through sunshine. So what I recommend my patients do is base load with 10,000 IU of vitamin D, because guess what? In this country, with the best will in the world, nobody can get enough sunshine. And then over and above that, get as much sunshine as you possibly can. Now, don't lie out so that you burn. That's just stupidity. So don't burn, but go brown. And we should all be as brown as berries by the end of the summer. And little and often exposure whenever you possibly can. Because sunshine is another one of those wonderful multitasking tools which I love to use. Guess what? When the sun shines, it's free. Anybody can access it. It's a joy. It also helps to detox you. It also helps to kill infections, because the ultraviolet penetrates through the skin and will kill any infections that are in the bloodstream. How do we know this? Treatment of tuberculosis, 1930s, sunshine, very effective treatment. It also improves the circulation, and the explanation of this is all comes through the fourth phase of water. But the point is, sunshine is a fantastic multitasking tool. It's cheap, it's effective, anybody can access it, side effects, zero. So go sunbathe.
Okay, thank you. Another question that's come in is, do you know if an antibody test for COVID is likely to be available soon? I can mention that AONM, AONM.org does offer antibody tests, but they would need to be ordered via a therapist. But if you'd like to see those because you need to, or you'd like to access one privately, then have a look at AONM.org. You'll see it very clearly there, and then you can contact your therapist if you're not one yourself. But Sarah, are you able to answer, or would it be okay if I now ask you a few questions not directly related to COVID-19, but more?
Yes, of course. Yes, of course. Far away.
One that came in earlier was, my 25-year-old son has been ill for many years with Lyme and co-infections and had antibiotic treatment for 2.5 years. Largely successful, but now we just can't break through the severe fatigue despite supplements and vitamin B12 injections twice weekly, so he remains bedbound. And this is an interesting question here. How do we know when the problem isn't infection any longer and is more likely to be, for example, a need for rehab or ME, or in a different definition, or perhaps his Hashimoto's causing the fatigue? Is there anything you can answer to that, or is that too patient specific?
Well, no, that's fine. It illustrates the point that there are two aspects to treating people with ME. There's the inflammation aspect and there's the energy delivery aspect. Now, it sounds like part of the inflammation aspect has been effectively treated. Great, but I don't suppose the energy delivery mechanisms have been properly addressed. And so often this comes back to the right fuel in the tank. I have an ancient diesel truck out there that trots me around the country when I need to go anywhere. But if I put the wrong fuel in that, if I put diesel in that, guess what? It doesn't go. It's going to crash very quickly. And the correct fuel for our mitochondrial engines are ketone bodies. So the paleo ketogenic diet is absolutely essential. And this leads on to another point. If you are eating carbohydrates, almost certainly you will have a fermenting gut. So what ferments in the upper gut will be bacteria and will be yeast. Now, from an evolutionary perspective, mitochondria derive from bacteria. So if you've got an upper fermenting gut and you're taking supplements to feed mitochondria and feed your body, well, they're not getting to your body. They're simply feeding the fermenters and making the fermenting gut problem worse. So not only do we have to address all aspects of energy delivery mechanisms, but we have to do it in a certain order. And these days, with COVID-19 and so on, I've started running workshops, and anybody can attend these workshops. I spend a whole day talking about chronic ketone and ME. So the workshops last 7 hours with a break for lunchtime. And you can access them through my shops. If you go to my website and link to my shop, anybody can book in for a workshop. And we cap it at 20 people at a time. But it means that I can effectively treat 20 people at one session, because the basic workup, the roadmap, the overall strategy is exactly the same. You know, there's nothing difficult about this. And I've got to the stage in my life where, you know, I now have got, as I call it, the rules of the game and the tools of the trade, so you can get well yourself. Because the fact of the matter is, there aren't enough doctors to go around, there aren't enough therapists to go around. You have got to get it sorted out yourself. So I have to teach you to be your own doctor. And we've had some great feedback from these workshops already. And you know, the simple things done really well get you an awful long way. So join me in a workshop and maybe I can help you directly.
How can people contact you, Sarah? Do they just contact you via your website to join up in those workshops?
Exactly. If you go to drmyhill.co.uk, there's a link to my sales website, and there the workshops are available. So just click on there, register an interest, and I will throw up as many workshops as are necessary to cope with demand. So there might be a rush in them in the short term, and then it'll die a death. But so far, people have found them helpful, and are making progress as a result.
Thank you. Can you do the Paleo ketogenic diet if you're a vegetarian? There's a question here.
Of course you can, and I do have vegans who do the Paleo ketogenic diet. I have to say I don't recommend that, but it just makes for a rather less interesting diet. And I'm not a vegetarian myself, so I don't, you know, I would hate to advise them how to do it. But as I very cruelly say to my patients, my job is to get you better, not to entertain you. So, you know, if to get well, you have to eat a rather limited diet with lots of avocado, pears and coconut oil and vegetables and certain nuts and seeds, well, so be it.
Okay, thank you. Another very, I think, important question here is, do you think we'll see a rise in ME patients post-COVID?
Absolutely. And this is my big worry, that, you know, we're going to see an explosion of chronic fatigue and ME patients, because we know viral triggers are very good at switching on these wretched illnesses. And again, this is even more reason why we must apply these nutritional approaches in order to prevent, you know, a chronic ongoing problem. I mean, already some of the patients I've had dealings with who have had COVID-19 are taking, you know, a jolly long time to recover. So yes, I think we will see a definite spike in chronic fatigue, post-viral chronic fatigue in patients.
And that is a question that's come in about 3 times, is people mentioning that they have had COVID. Some of them have come out of hospital, they're feeling extremely fatigued and still have some of the symptoms. They're asking whether there's anything specific they should do, or just look at your website that you've mentioned and take the tips off there, presumably.
Absolutely. You know, these treatment approaches I'm using, the groundhog regimes I'm talking about, are across the board, and it doesn't matter if somebody comes with cancer or dementia or chronic infection. The basic approach is exactly the same. And what I now know is that the basic approach done really well sorts the majority of problems. So yes, get onto my website. The information is there free. If you want to read it from a book, they're there in the books. But you know, those patients need to put in place groundhog chronic interventions, and those done well will get you an awful long way. I can't hear you, Gillian, at the moment. I'm really sorry.
Sorry, I'd gone on to mute. Another patient here is asking, what causes unrelenting neck pain despite all other symptoms from Lyme and co-infections improving? Okay. That's something you can address?
But during the 1980s, I worked with a wonderful doctor called Dr. Honor Anthony. She herself worked in cancer research. She was very allergic, and she went on to work at the Airedale Allergy Centre, which was an NHS-run institution specifically for allergy patients. And I remember her saying to me then, all arthritis is allergy. And I remember thinking at the time, no, that can't be right. I don't think that's right. And I now know she was 100% right. Yes, we know arthritis can be caused by food, but increasingly I'm recognizing that many pathologies are driven by microbes from the fermenting gut. Now, at medical school, obviously, we were taught the gut is full of bacteria and yeast. Yes, we know that, and there they stay. We now know that's not correct. some of those microbes from the gut do get into the bloodstream, and that's called bacterial translocation. If there are fungi there, they will get into the bloodstream. If there are bacteria fermenting in the gut, they will produce bacterial endotoxin. If yeast are present in the gut, they will produce yeast mycotoxins. And I'm now quite sure that many pathologies are driven by microbes from the fermenting gut, which might be whole microbes, or it might be their endotoxins or their mycotoxins or whatever. But the point is, those microbes get stuck in parts of the body. Now, if they get stuck in the liver, I beg your pardon, if they get stuck in the kidneys and the bladder, they drive interstitial cystitis, which is a horrible condition which feels like, you know, chronic urinary tract infection. They get stuck in the skin, I suspect that drives urticaria and probably, you know, ulcers. If they get stuck in the arteries, they drive vasculitis, like temporal arteritis, and there is a vasculitic component to COVID-19. But if they get stuck in the joints, they will, or the connective tissue, they will drive inflammation there. And many inflammations of the joints, connective tissues, of muscles like polymyalgia rheumatica can be explained by this mechanism. And the treatment is the same. You know, tackle the gut first, sort the gut out, and many of those distal pathologies then settle down. So it's back to the groundhog regimes. You know, how do you treat the fermenting gut? Starve the little wretches out. Don't feed them sugars and carbohydrates. You know, eat a diet based on fat and fiber as fuels, and then kill them with vitamin C to bowel tolerance. Join.
There's one. I'm sorry, I talked over you there for a moment by mistake. One question here, I can imagine your answer, but I'll ask it anyway. How do you cope with patients who won't or can't give up sugar?
Well, that's not my job. You know, my job is to teach them to sort themselves out. And if they won't take the lessons on board, then don't waste my time. And I'm afraid in my old age, you know, I've become a nasty, you know, ruthless swine. And maybe difficult, but it's an addiction, sugar, and many addicts deal with an addiction by taking up another one. So people stop smoking and they eat sugar instead. People stop alcohol and maybe they take up, you know, sugar instead. And sugar is the last and the most pernicious addiction. And if you see sugars and carbohydrates in an addictive way, then you can understand why people do it. But all I can say is, I'm giving you the choice. Either you can follow this route to good health. If you want to die from addiction, that's up to you. And believe you me, I have dealt with some patients who've been alcoholics who said, look, you know, I know it's going to kill me. I'm happy drinking and I'm going to drink myself to death. And guess what? They do. The same is true of sugar and carbohydrates. But what my experience is that the prospect of giving up sugar is much worse than the reality. And when they really get into it and they do the diet properly, and they come out of keto flu and the ketogenic and the hypoglycemia and all the problems associated with making the swap, they look back and say, why did I make so much fuss about it? You know, it was easy. You know, I've done it and here I am. And I have to say, a very, very useful tool that I now recommend all my patients use is a ketone breath meter. And I don't know if you can see me, but there's one there.
No, your picture is frozen, unfortunately, Sarah, but maybe it'll ease up again. Oh, there we are. Yes, we can see it a bit better.
Ketone breath meters are very helpful because they tell you when you're on track. They tell you when you're doing the diet correctly, and that is hugely encouraging.
It makes it a bit more fun, doesn't it? Yep, yep. There are so many questions here. We've had over 60 questions, and I've only managed to ask a fraction of them. And then, you know, we have several sets of questions coming in from forums. So I'll discuss with you afterwards what would be the easiest way of answering those. Maybe we could group them into categories, and then
group the categories. But I say many of the answers you will find, you know, on my website where all my information is available free, and on the coronavirus 19 website.
Yes, I have put that up.
If you'd like me to repeat this hour, you know, another Tuesday, then I'd be only too happy to do that.
That's a brilliant idea. Maybe we should do that. Yes, because we've come to the end of the hour now, and I don't want to keep you a lot longer. Thank you so much, Sarah. Yes, let's do that. Let's have you up again or on again very soon. Thank you. And
Lynn, you're always a pleasure to work with because you always ask the right questions.
Oh, thank you. Well, I mean, in this case, it was our listeners and everyone else on forums asking all the right questions. So thank you. Just to mention quickly that we will be putting this up on the website under events and then look at COVID-19 webinar series. We've already got Dr. Judy Mikovits up there, Dr. Armin Schwarzbach twice, I think, and Jenna Luce-Thayer, who spoke about human rights. And we'll be having further webinars, one a week. Already arranged is Dr. Joseph Jemsek next week, same time, same day, Tuesday, the 19th. He'll be speaking about the two pandemics, Lyme disease and COVID-19. Dr. Robert Bransfield is the week after that, the 26th of May. He's also talking about two pandemics, but from the point of view as a psychiatrist, the more sort of neuropsychiatric manifestations of both diseases, Lyme and COVID-19. And further webinars are also up on our website, so please do just have a look. It's again under events, COVID-19 series. So Sarah, thank you so much. Look forward to having you up again, on again.
And thank you, Gillian, for organising this. I know what a nightmare it is organising things like that, so a big thank you to you.
Oh, not at all, thank you. And to everybody who's attended, thank you. And we'll answer your questions as best as you can, but preferably just in a couple of weeks with Sarah again. So thanks a million, Sarah. Bye-bye.
Bye for now then. Bye-bye.
Bye. Bye.